Hi everyone, Dr. Suneel Dhand. Welcome to another video. It is time for the latest edition of the clown world that is frequently US public health. And I want to share with you a message from one of the largest public health departments in California. Now, lots of people know that California is a state which has dramatically lost its way over the last couple of decades. But take a look at this message from LA Public Health. Committed to protecting and improving the health of the over 10 million residents of LA County. This is their Twitter feed. Healthy people in healthy communities. But wait, what's this within the last few days? Rediscover your midnight cravings. Indulge safely. Get boosted. Randy's Donuts, Inglewood, County of LA Public Health. Whoa, is that for real? Did I imagine things? This is the LA Department of Public Health promoting a message using a donut store. Now, I have never heard of that donut store before, but is there some type of collaboration between LA Public Health and a donut shop? Now, don't get me wrong, everybody can enjoy an occasional treat, but of course, for way too many people, treats are not really treats, they have become a habit. And if anybody in LA Public Health thinks this is some type of joke, you are welcome to shadow me one day as I see my patients, and you can see the metabolic health catastrophe that we have in the United States. Soaring rates of metabolic diseases, soaring rates of type 2 diabetes, heart disease, obesity. This is no joke. And what's worse is, this message initially was put out in Spanish. And sadly, statistics show that the South American, Hispanic, Latino community is one of the worst affected by metabolic diseases. But here we have a major public health agency mixing up donuts with getting boosted. And indeed, there may be some collaboration with the donut company. How utterly ludicrous and ridiculous, and what a travesty of good public health. I am speechless. What can I say? But I am not done yet, because this week we also had another message from another major public health figure in the United States, and this is the CDC director herself, one of the top supposed public health influencers in the United States. Let's take a look at this. Rochelle Walensky, CDC director. Following World Health Organization recommendations, CDC will begin using the term Mpox. We welcome and support the renaming to Mpox to reduce stigma and barriers to care for those most impacted. This is the renaming of Monkeypox, which has been in the works for a few months. Let me get this straight in my head so I understand correctly, because this is the CDC director, it's not some random person on the street simply tweeting. The CDC director, one of the nation's top doctors, thinks that there are people in the United States who had monkeypox, who didn't seek care for monkeypox because it is called monkeypox. Have I got that right? But this highlights another huge problem that we have within public health and even healthcare in general, is that we are so focused on these superficial issues. We never have serious discussions and try to get to the bottom of root causes, try to solve actual problems. It's all this superficial stuff, which really is going to do nobody any good. I want to know, was there really anybody out there, or anybody more than the 10 people in the world who probably have way too much time on their hands, who truly took great offense at the term monkeypox? I really want to know how many people in the country were really offended by the term monkeypox. These are people with way too much time on their hands. This took months. How many resources, how much time, how much money was put into renaming monkeypox Mpox? And couldn't a 15-year-old have done that in 2 minutes if that was what you wanted? Again, speechless. Thank you all for listening. Dr. Suneel Dhand. Let me know your thoughts down below. Remember, these things, modern mainstream culture will make you very sick very fast. There are huge elements of the medical establishment and of course Big Pharma who really benefit financially from people being as sick, chronically unwell and obese as possible. People don't have to go down that path. That's not the inevitable path of living in mainstream culture. There is a way out. Sadly, a lot of healthcare and medicine has become very corrupted indeed, and fewer things are to be more cherished than our freedom. Also come follow me on my uncensored platform, locals.com. That link is down below, where we have more open, honest, interesting discussions about health, well-being, about the pandemic response, about the corruption in medicine, away from this environment of big tech, censorship and silencing. An absolute disgrace, I need to say that in the United States, but I do. We will talk again very soon.